Assalamu alaikum. My name is Hafsah Qureshy. I will be talking to you today about making a birth plan for a VBAC mom. Many tips and suggestions and samples. I am a certified VBAC support practitioner. I'm the director of the newborn care program with Birth Kuwait. It's a non-profit organization in Kuwait, a small country in the Middle East. Um, I'm a certified childbirth educator with Amani, trained doula, breastfeeding counselor, lactation educator, and a newborn care specialist. So I'll talk to you today about what we will cover first. Okay, so the agenda for today's presentation is going to be first we'll start with what a VBAC mom exactly needs, the support and guidance she needs, the WHO guidelines, which back which help us and which kind of support our decisions if the doctor or our care provider is not so supportive. Laboring tips for a VBAC mom, care provider. What's very important regarding your care provider or your doctor, for example. Then we will look at a basic birth plan, a visual birth plan, which is very important, a backup plan. Then we will discuss the brain way of thinking, how our brain thinks, um, and making informed decisions based on that, obviously. Birth plan approval, who and how. There are certain ways and steps on who should approve your birth plan before you give birth. Okay, and what happens if we don't know what's destiny, things could change, so we should be prepared. So we'll look into that as well, and how I can help you more after this small short presentation. Okay, so let's start. Okay, so what does a VBAC mom need? I am a VBAC mom myself. Let me give you a little introduction about myself. I've had a very traumatic C-section 9 years ago. It was an emergency, unnecessary C-section because I was naive. I did not know. I was not educated. And this is what embarked me onto this journey to help educate VBAC moms. So when it came for my second baby, I made sure I was much better informed. I was educated. I had a lot of support, guidance. So I started off a mom like you who's watching my little presentation. I started off as a mom like you, and then it grew on to be more of a passion, and this is what I do today. So I remember when I was planning a VBAC, I did not want to go through the same what trauma I went through with my C-section. So it took a lot of planning. Not the planning was not just when to have a baby, but the planning was how to have a successful VBAC. A VBAC mom's mind, because I can relate, I've been in this place. A VBAC mom's mind is very confused at a certain stage. The doctors usually pressure us into a repeat C-section. They tell us all sorts of stories and all sorts of scary outcomes if we have a vaginal birth, and the top one is usually uterine rupture. They do not tell us the risks of a C-section, which are usually more. I'm not going to go into details here. That's a separate presentation on its own, comparison between and the decision, the statistics of a C-section, repeat C-section, and a VBAC. So a VBAC is usually the most safe option for a VBAC mom if she is a very good candidate. So what a VBAC mom needs is support. Number one thing is support. The maximum support you can provide. I work with moms even online. I provide them virtual support, and it makes a ton of a difference. My VBAC rate with moms, the moms I work with, is 95%. So many moms end up having successful VBACs, and all they have is just virtual support from me. What do? I provide them guidance, correct numbers and statistics. I calm down their fears. I tell them, I guide them. I give them red flags if their doctor is not really supporting them. And then some of them have even changed doctors at the last stage. So support is very important, even not just during labor, before labor, before the mom goes into labor, during her pregnancy, or even before pregnancy when she's planning her VBAC. So a mom needs support. Guidance is the second thing. Guidance, telling her and educating her. Education is extremely important. In this presentation, I'm just going to focus on the birth plan aspect, but if you can educate yourself more, attend childbirth education classes, attend VBAC workshops. I give them online as well. Attend them, get as much information as you can, read lots of books, as much as you can, educate yourself so you know, and have someone guide you, someone who knows more than you. And then you will know, your heart will know, your husband, your mom, whoever's supporting you, they also need to be educated with you so that you have the correct support and everyone's on the same track. Okay, so support, guidance, and a lot of motivation. These are the three key things that any VBAC mom needs. Not some medical expertise. Yes, she does need a doctor, but delivering a VBAC baby and delivering a normal baby is exactly the same thing. So doctors sometimes hesitate. What if because the risks of uterine rupture is so small, it doesn't really make much of a difference at all, unless of course it's a high risk pregnancy or other things contribute to that factor. So the medical part is much smaller than the emotional and supporting the mom physically as a doula, or throughout her pregnancy, or educating her physically is much more important. Okay, so what you need, what you as a VBAC mom needs, or you guiding a VBAC mom need, is supporting her throughout. Even if it's even during labor, like virtually what I do is just sending them positivity, just sending them encouragement that they can do it. And they do end up doing it. They can do it. I did it. I'm a VBAC mom, twice VBAC mom. I've had two VBAC babies after my first traumatic C-section. What really mattered, there was a time even with my second one, although I had had a vaginal birth, with my second one, I was um, terrified. What if things go that way or that way? And then I had my support system. This is me being educated as well. When my support system, they lifted me up. They said, you know everything. Everything's going to go fine. So don't just block out your fears. So you always need some more extra support, extra guidance, and of course, a ton of education. Okay? Next, see, there we go. Supporting guys, and this is what I was talking about. So, a VBAC, in my terminology, what I like to tell VBAC moms is that you're very brave and you're courageous. That's what a VBAC means. It's because birth is not a very, it's portrayed to us as though a VBAC birth is very scary. But you are brave, you're courageous. It's not because it's risky to give birth, but because it takes courage. You stood up for yourself, for your baby, for your well being, for your family, and faced the opposition. I saw 18 doctors and only found three who were supportive of a VBAC, and I pursued those. I know moms in other countries. I just have a recent mom who do not have a support at all, not even one, but she's standing her ground. She has my support. She has her educator support. She has her doula support. So her support and guidance is making sure that mom who doesn't have a very, very pro VBAC doctor and who's giving her deadlines, that mom is continuing on and is very positive for her VBAC. And I'm very confident, inshallah, she'll have it because she has the correct guidance support and she's in the correct frame of mind because of all this. She is very positive. So this is what I want you all to be. Be very brave and be very courageous. You can do it. And I'm happy to say that at least in Kuwait, the statistics, the number of VBACs is increasing on a yearly basis. I mean, what it was 5 years ago when I had my first VBAC and what it is now, it's big difference. And even me, Annie, I deal with moms And the number of doctors supporting VBACs has increased as well because moms go to them more informed and more educated. So doctors are ready to help that mom. Otherwise, they can easily scare the mom into having a repeat C-section. So that is very important. Support and guidance is extremely important. Now, I said we'll touch the WHO guidelines. Now, these are new ones, and I really like them because this all supports VBACs more. Okay, so number one, all women have the right to a positive childbirth experience. So no mom can be blackmailed or scared or forced to do anything. They have to be treated with respect and dignity. They have the right to have a companion with them. I know, at least in this region where I am, not all hospitals, especially the government ones, do not support this, but many of the private hospitals do support this. And I was able to have my own doula and my husband with me during my birth, so which was amazing. So this is very important. This is the World Health Organization, so we can actually tell our doctor this is what WHO says, so we have the right to this. Clear communication by the maternity staff, nothing to be hidden by the mother. Be informed, know what's happening to you, have informed consent if they ask for you. uh, Pain relief strategies, not just giving them only one option. No, give them step by step, help them, guide them. This is the part of the WHO guidelines. Mobility in the labor and birth position of choice. Now, that is very, very important. We'll be touching that when we learn how to make our birth plan. I'm glad the WHO now considers this as an important guideline for any expectant mom, that she needs to be allowed to move, not strapped down to the bed, and she is allowed to labor and birth in any position she wants, not just on her back. Labor progression at 1 centimeter per hour during the active first stage may be unrealistic for some. Having expectations that a mother should be progressing to a certain in a certain time frame, if she's not, blah blah blah, we take things the other way towards a C-section or something. This is very, very stressful, and this can actually with labor, what with the hormone you need, I'm just going to touch basically, like I said, this is a more detailed thing. The hormone you need is oxytocin, which is the relaxing hormone, the love hormone. When you give them a timeline, and when you give them fix that you should be doing this in this amount of time, you are stressing the mom, the dad, and increasing adrenaline hormone, which cancels out the oxytocin, and obviously this would um, stall the labor or cause failure to progress, or things could go negatively, which we do not want. So I'm glad now the WHO guidelines state that this is unrealistic. A mother let alone should be left alone. She can labor and progress at her own pace. No need for extra medical interventions, because medical interventions, for example, they could give pitocin to speed up labor, which has adverse effects and could cause fetal distress or something. And pitocin itself, we'll be touching that as well, could be risky for especially a VBAC mom. So yeah, we have to keep realistic approaches towards the progression of labor. Now, every birth, the third point here is every birth is very unique. Some progress quickly and some don't. With my first VBAC, I was in labor for almost 3 days. I went into labor on a Wednesday and I ended up giving birth on a Friday evening, and it was perfectly fine. Everything was fine. We'll touch what a VBAC mom needs to do to make sure all's good and she's okay to labor for days or for however hours, how her own pace, her own time. It is very, very important. And unnecessary medical inventions like, rupturing of the membranes or things like that are not necessary. Just let the mom labor and progress on her own if everything is good and controlled. Okay, so these are very key WHO guidelines which you can use and tell your doctor this is by the WHO, so I wish to abide by these and I wish to apply these onto myself, and I need your support as a medical doctor or midwife. From where you are, we don't have midwives here, unfortunately. Now, laboring tips for a VBAC mom. Um, I get a question often from VBAC moms, but I've never been in labor. How do I know is it labor? What should I do? So basically, a VBAC is like a mom giving vaginal birth for the first time. Some moms might have experienced labor and ended up in a C-section. That can happen as well. Um, how do you know it's labor? Basically, the tips for labor is that you would start feeling contractions. It could start off with a mild period like menstruation like pain. It could generate from the back, come towards the front, or from the front to the back. Uh, in the beginning, it would be bearable, it would be shorter, and as labor progresses, you would be able to tell a pattern, and it would start lasting longer, and you would stop, like, you would not be able to breathe during your contractions. And there are many apps available now which I highly recommend to moms to use, and it helps them. It takes the work off to having and sitting and calculating. That's the last thing you need to do when you're in labor. So using these apps cuts down half of your work, and you can see and detect a pattern, and even just send the whole timing and duration and gaps to your doctor or your midwife or your doula to know that how far or how you're progressing, and then they can guide you more. Okay, so this you could see early labor signs even a week or two earlier, like you could see a loss of mucus plug, some mild bleeding. You could have contractions, irregular contractions during the night, and in the morning they're gone. These are all your body working. Okay. Usually, what doctors tell us, oh, but you have not dilated. But dilation is not just a measure of the progression of labor. First, you need to efface, and then you need to dilate. Again, if you attend childbirth education classes, you will be able to study all this in much detail. So if your body is doing all this, but still you haven't dilated, but your body is still working, it's still preparing itself for the actual labor. It could still mean that you are um, still a few days or a few weeks off. I lost my mucus plug, I think, a week before I went into actual labor. So I knew my body was working and things were happening, and I was not pressurized. That's the most important thing. Now, what to do when you feel you're in actual labor? Like I said, get in touch with your doctor or your care provider or your midwife or doula. Let them know how you're progressing. For VBAC mom, I highly recommend that when you're in early labor, even just go in and get a non-stress CTG or an ST done. We call it a CTG here. I think it's called an NST down there. Just to make sure everything's good with the baby's heartbeat. Uh, like the NST CTG would determine if there's any risks of uterine rupture, for example, what they fear us about, or anything else. If the CTG is good, you can come back home, labor on your own. But yes, I highly recommend for a VBAC mom, this is one of the first tips, is get regular CTGs done. Even if you're like overdue, you've passed the 40-week mark, get one done every 2 days or every other day, so that you just know for the peace of your mind and to be on the safe side, everything's going well. So it's important to get the CTG non-stress test done, and you can get one or two ultrasounds done if needed by your doctor to make sure everything else is good. Okay, when to go to the hospital. Now, the hospital rule is basically when you have contractions which are lasting for up to a minute or more, and then you have 3 contractions within 10 minutes. Okay, so that each contraction could be every 3 or 4 minutes, and it's lasting for more than 1 whole minute. So that's the time. And in 10 minutes, you've had 3, basically. That's the time when you can start heading towards the hospital. Okay, but if you live far from the hospital, you might want to go when you're having a contraction one contraction every 5 to 6 minutes. Okay, when to be concerned. Now, In case you feel concerned about uterine rupture or something's wrong with your old scar, uh, you would feel stabbing pain. You would feel an unnatural sort of pain, different to the contraction. If you see, so this is like if you feel a very sharp or a different kind of pain, that's when you go to the hospital. That's when you should be very concerned and immediately go. Second thing, if you see bleeding, very okay, a bit of bleeding is fine because that's usually with the mucus plug and the thinning of the walls. But if it's a lot of bleeding and very fresh bleeding, I would suggest you go to the hospital immediately. And third thing, if you see a change in the baby's movement, and that's a very important time to go to the hospital and make sure everything's okay with the baby. Okay, so these are the three concerning points to make sure that you follow them and know this is like just just to be on the safe side, just immediately go to the hospital. If anything's wrong, they can take care of things there and then. With the CTG NST, you can get it done early labor if you want. If your labor is longer, like mine was 3 days, I hope it doesn't happen to many. I ended up going twice again in the middle just to get the CTG done. Everything was good. I came back home and I continued laboring at home. So this is when um, just this is you as a VBAC mom. This is what you need to do to make sure everything's all going well for in during labor. Keep in touch with your doula. Keep in touch with your midwife. Keep in touch with your doctor. I highly recommend that. Let them know how you're doing. Doctors tend to. That's why I always say having a doula is very important, so that you can make the right decision and not be pressurized, because doctors could say, oh, come in now and admit you, and you would not be so comfortable in the hospital as you would be at home, and you would prefer laboring at home. So having a guidance of a doula or a midwife might be a better option. So I really really say every VBAC mom should have a doula. Her success rate of achieving her VBAC is much higher if she has a doula supporting her. I know our husbands are great supports, but not all. And they can, if you're stressing, they can feel the stress and they can start stressing too. But just make sure that your husband attends childbirth education classes with you, so that he is equally educated and doesn't freak out and doesn't stress if things seem a bit uncertain, and he knows that he's well educated and he knows that what you're doing and the decisions you're making with your doula and your doctor and your midwife are correct. Okay, so it's because if he's the one supporting you, he needs to be educated. If it's your mom supporting you, she needs to be educated. So whoever is your support person, please make sure they are well educated with you. Okay, now laboring in the hospital. um, Once you reach the hospital, I highly recommend taking if the hospital doesn't have one, taking your big yoga ball. You can sit on it, you can bounce on it, you can lean on it, you can do hip rotations, you can basically, it's your best friend in the labor room. So take that. If you're in the hospital, walk. Um, Tell them, we'll touch that again. Tell them you don't want the drip to be inserted. You can just have the cannula um, done just on the safe side, because the last thing you want them poking you when when at the crucial time. So just get the cannula done in the beginning. Be free, no pipes attached. Just tell them, just cannulate me, do not connect me. So you can walk around, go for a walk between the wards and everywhere. Have a support, your doula or your husband help you around. Positions. Take a yoga mat with you in the hospital. So you can put it on the floor and be on all fours, or you can put your yoga ball on it to prevent it from slipping. Um, on the bed, squatting, use a chair, use your yoga mat to squat, everything. So doing different positions during labor is very helpful, even if you're laboring in the hospital. Most hospital labor rooms, I'm not sure how it's there here. They have private labor rooms, so they have private bathroom. So using the shower is a very, very good pain relief technique. So you having a warm shower on you, it's a very good laboring tip, because as a VBAC mom, I don't recommend taking the epidural, or because what that does is kind of confines you. You're on your back, you're not in the best position, and it can actually stall things, and things can go south because of lack of movement. So gravity, movement, walking, different positions, all these things help. Now, for all this, you need good pain management. So, massaging, having your partner or your doula massaging you during labor. What helped me was sitting on the yoga ball and putting pressure on my shoulders. Helped me a lot during the labor contractions. Leaning on the ball, hold the ball and lean forward. This helps. So basically, you need different pain management techniques so you avoid taking interventions to manage the pain. You can, like I said, the shower, warm water really helps with the pain. If there's a bathtub, that's even better. You can just get into the bathtub and labor in the bathtub or a pool to help with the pain. So all these things make sure things keep moving along. And the I'm going to be touching that in the birth plan, how to make sure they don't strap you up with the CTG monitor, how a monitoring is done for a VBAC mom. Okay, so basically things are very similar to it's not very different, any mom in labor, but just a few tips. Like I said, pain management should be much more, um, like comfort measures during labor should be much more for a VBAC mom in comparison to a normal mom. She might opt for an epidural, and it might not be so. I mean, I don't recommend epidurals, full stop, but for her, it might not be so risky as it would be for you. Um, and for her, she might be able to take an epidural and then take more interventions that would not cause anything. Any, but for you as a VBAC mom, I don't recommend it at all. And use other tips. Like I said, having a doula is very important for you to push through, even at the crucial transition phase. You need someone there to support you, and it really helps. Okay. Now, not like you're ready, your doula's ready, your husband's ready, everything's good. Having a good supportive care provider or doctor is very, very important. Um, Make sure they're VBAC friendly. Some are tolerant. That's why I've put this list from Birth Blissfully. What I hear the most here is that the doctors won't let you go beyond 40 weeks. But why? You know, that's my first question. So if a doctor says this, that's number one first red flag. So you'd want to look for a doctor who's willing you to go up to 42 weeks and let you go into labor naturally. Um, a doctor who's willing not to do any interventions is very important as well. Induction and all that. If she starts using these words, I'd be a bit concerned. Um, Baby's weight. I don't know why, but this is a very common scaremonger used with moms in especially, like, I think it's not just VBAC moms, it's any moms actually, that, oh, but your baby's big, you've got a big baby, you cannot deliver him vaginally. Well, I'm sorry, but how are you so sure that this is the baby's weight? We should know that the weight at 9 months on the ultrasound is very inaccurate. They cannot see the whole thing in one go. They just can't. It's not accurate at all. So always remember there's a chance of 500 grams, and 500 grams make a big difference for something, a little tiny baby. So do not let the fact that the baby's big freak you out or get you, thinking otherwise. Oh, but my baby's was big. That's why the doctor said. I was told my baby was 3.9 kilos, and the poor little girl came out basically 3.1. So that was a big, huge difference. And similarly with my son, I was told that he was 4.1, and he came out 3.35. So there was a big, big difference in what they tell us and then what is the actual reality. Okay, so don't let the baby's telling them that the baby has to be under a certain blah 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 pounds or kilos freak you out. Be informed. Know that there's no such thing as a big baby. You know. Again, here it mentions the progressing. You know, the WHO guideline we discussed, progressing at a certain centimeter per hour. If the doctor says that, you don't want that doctor. A doctor who says, you know, as soon as you're going to labor, come into the hospital. I'm sorry, but you don't want that as well. You want a doctor who's okay with you calling in and telling her, blah, 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 you're progressing, and discussing, should I come in now? You know, she should be flexible in this sense. Um, Epidural interventions, these things are, if a doctor says, but you should do it, you know, blah, 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 I would be very concerned about that, because she just wants things to be easy for her and not for you. Okay. Fetal monitoring or placing the catheter. Ask her procedures for birth, basically. If she thinks that the CTG monitor should be hooked in all the time, I'm sorry, you need to change the doctor, because you don't want that. You want mobility. Catheter, no need for a catheter initially, or even like uh, throughout birth. If you're having completely natural birth, no need for any catheter. No, just in cases, no need for those. Um, Episiotomies, check her episiotomy rate, how often she has them. Even check, you know, you can check your care provider's um, VBAC rate, or her multiple VBAC rate. I mean, if she's supported moms who've had multiple C-sections, it's very important to know and ask her, or even ask, you could maybe, I don't know how it works there, but you could ask the departments how the hospital's general VBAC rate is, and maybe the hospital is financially forcing doctors to go for C-sections. So this would give you a statistic, and it will help you make your decision, um, and change your care provider or stick with them. This will really help you make this decision accordingly. So having a supportive care provider is very important, because on the day, the last thing you need is just a few days, or on the day you're giving birth, they change their mind or start saying something else. So make sure you discuss your wishes, what you want, multiple times at every checkup, at every antenatal appointment. Just make sure you always tell what you want, so they know that this mom knows what she's asking for, and this is what she will ask for, and I should or should not, like, you know, you would know with how supportive your doctor is. Okay. Now, a birth plan. There are many sample birth plans on the Google. What I recommend is every mom write their own birth plan. Once you've attended childbirth education classes, you would exactly know what you want for your birth. Okay, you will be well informed, you will be well educated, you will know what you want. So once you start writing your birth plan, it could be a simple one like the one I have on the screen, or it could be like just bullet points or just ticks like this. With just always make sure you have your full name, your doctor's name, your husband's name, your doula's name, um, your file number, you know, all these things, all on the birth plan clearly printed. So because sometimes the nurse staff is usually changing shifts and stuff, so they should know that this is for this particular mom. And so your birth plan can look something simple like this, the one I have on the screen. I'll be going into detail in a bit about the options and what you should have and what you should not have. Okay, or your birth plan could look like this. Now I'm just going to go back and forth. So this is a visual birth plan. It has like pictures, okay? And then let me go back previous. And this is a birth plan which needs reading. Which one do you think is more effective? If for example, you were attending someone's birth, or you were helping someone with something else, if someone gave you something like this, all writing, or someone gave you something like this, which has pictures, which would be easier to follow? Definitely the pictures. This is called a visual birth plan. This is actually my birth plan for my baby. She turns 1 in 1 week. So this is what I used last year. And so lots of pictures of what I wanted category wise, with a backup plan. We'll be talking about the backup plan soon. So it's very, I feel having pictures over text is very important. They look at it, oh, boom, she wants this. Oh, yeah, okay, she wants this. She wants the placenta to be saved. Oh, she wants to use essential oils. Oh, she says limited cervical exams. So these things help, especially the nurses or the pediatricians on call or the head of nurse, whoever is there at your birth, because your doctor would actually know because you would have discussed all this with her before. But if it's someone else you've met for the first time on the day, which is very likely because they call your doctor by the time the doctor comes, it's you've dealt with a lot of many people before that. So they need to know you want all this. Okay, you want to breastfeed as soon as possible, no pacifiers, all this is on it. Okay, and it's very, very easy to read a visual birth plan in comparison to just writing, because you'd have to actually read the writing. With the visual, you can just see the picture and understand what um, this mom wants, basically. Okay, so I highly recommend getting this printed out, laminated, stick it in a plastic folder, anything, and just take multiple copies with you, hand them out to whoever you see, so they know this mom knows what she wants. Okay, visual over written, but do have a written comprehensive one. What I did was I had this for the day, and then I had a very comprehensive one to discuss with my doctor. So yeah, have a comprehensive one and then make the visual based on your comprehensive plan. That's my first tip. Now, a backup plan is very important. Having an emergency backup plan. Um, don't let this scare you. That's the first thing I'd say. But be prepared. Um, Destiny. Only Allah knows what's actually going to happen. But if we are prepared mentally that, uh, if things go the other way, then at least we were prepared with a backup plan. And in that, we had listed our choices. For example, if you do end up requiring an induction, you can say, I want a mechanical induction only with the balloon, the Foley's balloon. You could say you could have it in your birth plan, no Pitocin, because you don't want the risk of rupture. Pitocin causes stronger contractions. If it's a C-section, a repeat C-section, then you could say that you want an epidural in comparison to a spinal. The recovery in epidural is easier than to a spinal. I said I wanted a gentle cesarean. I wanted my husband to be with me in the OT. I wanted my arms to be free. No, like, the cannula, okay, but my arms free. And even the heartbeat stickers and stuff they put it, they can just put it on your shoulders or your back or up so that you can do skin to skin with your baby. Breastfeeding in the OR, no sedatives. So that I remember with my the traumatic C-section I had, they gave me sedatives, and I do not remember seeing my baby as soon as like he was born, and they wanted to show it to me. They'd given me the spinal, but they gave me sedatives, so I do not remember until I woke up 3 hours later, and I could not breastfeed him. And then my breastfeeding journey was all um, messed up, so it was like a domino effect. So you can put preferences for a C-section or an induction if needed as a backup plan, so that you're prepared mentally, and this would actually have a positive impact on you in comparison to having an unprepared emergency C-section, which you do not have any say in. So always have a backup plan, but be positive. You tried your best, everything. You did your best. You did everything you could do. If that all didn't happen, if I had to go for this, I did my best. So this would give you the sense of still achievement, no disappointment, no depression, and inshallah, it goes smoothly as well for you and the recovery. Now, here I'm going to start discussing this birth plan step by step. First of all, it's going to be the general preferences, which could be, for example, for me, it was I wanted ladies only, no male, no men. I even put a little note I printed out, no men allowed, and I stuck it outside the labor room I was in so that no men come in by mistake as well. No cleaning men, no nothing. So that was one of my general preference. My second preference was having a dim, a light, relaxing atmosphere in the actual labor room. Now, remember the birth plan. If you're, I'm focusing mainly on hospital births. You can make a birth plan for a home birth, but since here we're focusing on a birth plan discussion with the doctor, so we are focusing on the hospital part. So even in the hospital, you can ask for the lights to be dimmed, off, curtains to be closed, open, however you want it. Just make sure you tell them that background noise if you want to play light music, or if like I wanted Quran to be playing, the lovely Amani CD, I was using that. So having dimmed light, relaxing background sound playing really helps a mom focus on her labor, lets her relax, release those lots of oxytocin, which helps speed things along. I wanted my support person, people, well, my husband and my doula, with me, and I wanted minimum interference. I did not want knock, 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 knock. No, I did not want, even if it's the nurse, for example. I did not want them coming in every half an hour or every 10 minutes, 15 minutes, bugging me, you know? I wanted minimum interference. So I made sure I told them that. I knew I had my doula, I knew I had my husband. If I needed something, I knew I could call them. Okay, but I had to tell them that. Otherwise, they would just go on with their routine, you know? Maybe their routine is to check every 10 minutes. So make sure you tell them that. You have to tell what you want for your birth. Exactly what you want. Maybe that's what you want. You want to be on the safe side. You want the nurse to check on you. So you can say that to them. Maybe you want the nurse to be with you all the time. You can ask that. Maybe you do not want your husband to come in. He might freak out. You don't want your mother-in-law to come in. You make sure you tell them that so that she just doesn't come in, you know. Maybe it's your mom who you want to be with you, and you could even add that if any of my support people show distress, they're allowed to leave. Um, so you have to be very clear on what you want. This could all be in a comprehensive birth plan, and then you can use little images to make your actual birth plan. Laboring preference, you could say that you could tell your doctor that and write in your comprehensive that you will labor majorly at home, you'll keep in touch, and then when you come into the hospital, you want to continue with the comfort measures you're using at home and bring your ball and things like that. We'll come to that next. Okay, food and water is very important. You don't want them to hook you up to the IV. Oh, but you'll get dehydrated. Well, just tell them I want to eat, I want to drink as my preference. I do not want to be using medical preferences because, with an IV, if they stick the IV in, it causes extra fluids to come into your body and could actually cause things to swell up. And even down there, it can swell up, and usually it can end up with more tears when the baby comes out because the skin is so tender from all the swelling. So you want to avoid that, and you can just stay dehydrated. Take little sips of water, ice, eat dates. Dates are very, very good for labor. So this is what your preference is for early labor, and they should know that this is what you would be wanting. Next, we go on to the active labor. You can tell them this is when I'll come to the hospital, or if you're giving like here, I'll just bring a little bit of the home birth in. Um, you'll be this is when you'll be calling your midwife, for example, if you're giving birth at home. Again, here you would want to tell them uh, that you want what kind of atmosphere you want. Like I said, even the temperature of the room, you could ask them that I want things to be on the warmer side or I want them to be on the cooler side if you're a person who heats up fast. Comfort measures, you want to bring your own birthing ball, you want to bring your own favorite pillow, your blanket. I had this little soft cloth which I like, so it was like a comfort, like babies have. So I had one which I made sure I took with me. So anything that comforts you, you want to bring that in. You just put everything there so they know that this is what this mom will be bringing in, and they know and they're prepared. Okay, vaginal exams. Now, vaginal exams can be a pain, really. They can be so annoying and they can stress a mom up. They stress me up, so that's why I can relate. So you can say, for example, because now I think it's kind of important for doctors, especially to do these vaginal exams, but you can limit them. You can say that first of all, you only your doctor will do it because sometimes it takes a while for your doctor to get there. So just tell them, I'm progressing labor. I know things are happening. I know my contractions are coming, so you do not need to stick your fingers in. Um, when my doctor comes, only she will do my vaginal exam. And even with your doctor, this is what you'll discuss beforehand. Tell her I want one every 3 hours. Not every hour, not every half an hour. No, one every 3 hours. That's something tolerable. That's something I'd be mentally prepared for. Or if you want it every hour, you can tell her that. Whatever you want, just let her know about the vaginal exam. So limited vaginal exams was my preference. Yours might be different, but just put it in there on your birth plan. On-call doctors and nurses. Now, sometimes, since like I said, your doctor could take a while to come in, you can say that you do not want any on-call doctors to see you, or you don't want any on-call doctor to do a vaginal exam, or maybe you want one. Whatever your preference is, put it in your birth plan according. Nurses, like I said, I wanted limited nurses coming in, so you can say that, no student doctors. Some doctors, some hospitals have professor doctors who like to bring in their students to show them how things are happening, or educate them at the same time. I was very picky about that. I do not like an audience, so you can say no, no student doctors. Um, IV cannula, like I told you, you can allow them to cannulate you, but no hooking up, so that you're free to move your arms and hands and free to walk around, go to the bathroom, everything. No enema. Enema can actually cause dehydration because causes loose bowels, and it can dehydrate you. It can increase your contractions like a lot, and it can cause fetal distress. So I do not recommend the enema. Just tell them I'll empty my bowels myself whenever I want to go to the bathroom. Okay, no Pitocin. Be very firm on that. Sometimes they'll just say, "Oh, we'll give a small dose. It's okay." Just tell them, "No, I don't want it. It's an intervention. It can cause severe contractions. It can cause fetal distress. It can increase the risk of a uterine rupture." Okay, freedom of movement. Put that there that you want to just move. You want to walk. You will leave the labor room. You'll come back in the labor room. You will walk around the labor room. You'll do anything you want. You'll be on your yoga mat. You'll be on your bed. You'll be doing everything. Okay, intermittent monitoring. Now, the 220 rule. Now, this is a tip for a VBAC mom. VBAC mom CTG monitoring NST test, like the NST non-stress, is very important. Like I told you before, I stressed it because it tells them that things are going okay. Everything's fine with the baby and you and everything. It's very, very important to get it done, to avoid any risky things happening. So the 220 rule is 20 minutes of CTG monitoring. They'll strap you, they'll hook you up onto the bed for it, 20 minutes. And then off for 2 hours. Then again 20 minutes. Then off for 2 hours. This is when you're in the hospital in actual labor. So the 220 rule, 2 hours off, 20 minutes on. 2 hours off, 20 minutes on. Second tip I can give you is stay little bit tilted on your left side, because that's how the baby gets extra oxygen. So the results of the NST test, CTG test, would come much better. And this is the recommended position for. So when they're hooking you up, strapping you up to the CTG monitor, just make sure you tell them that you wish to be. You can use pillows to support you if you need. You wish to be on your left side more. Okay, so the intermittent monitoring is very important. Natural water rupture. Sometimes doctors say, "Oh, but if you rupture your water bag, your labor would progress stronger, like faster." We need to remember one thing: the the amniotic fluid sac. It helps cushion our babies. Let me bring the baby. Okay, this is my little baby here, and this is the. Let me put him inside the amniotic fluid. So this is the sac the baby's in. Okay, I'm just going to demonstrate it a bit. Okay, so the baby's in this little sack. Okay, this sack has the amniotic fluid inside it. So when you're having labor, the uterus is contracting. The baby's down, head down. Okay, the uterus is contracting, and this amniotic fluid has fluid inside it. So this provides a cushion for you and for the baby. So the actual contractions are much more tolerable for you and for the baby. Less chances of a fetal distress and more chances for you to bear the contractions. Like I said, pain management is very important. So the chances, if your water bag is not ruptured, the chances of you uh, tolerating the pain is much more than if they rupture the water bag and the just the contractions feel much stronger and much harder and much painful. So if it hasn't gone naturally, if it's gone naturally, that's separate, that's fine. But artificial rupturing of membranes is not recommended. Just tell them, I want them to go naturally. Some babies are actually born in their sac, which is very rare and a very special sight actually. And it's very possible they can. Why not? So it gives the baby more cushioning, you more cushioning, more bearable for you, better fetal outcomes for the baby. So natural water rupture, no artificial rupture of membranes. Okay, because another thing here in Kuwait, what the protocol by the Ministry of Health here is that if the water has ruptured, then the mother must go into labor within 24 hours, otherwise she would be induced. I don't know why this crazy, but this is how it is, you know. So basically, if the water bag's ruptured, the baby gets more prone to infections. That's the reason. So that's another reason you do not want the water bag to be ruptured artificially by the doctor, because you do not know how long the labor is going to progress, and the baby would be exposed to infections and everything if it's artificially ruptured. So no water bag rupturing. That's what you want. Pain meds. What kind of pain meds you want? I've written the TENS machine. It's very helpful. It kind of distributes the pain, so it's not focused, and it makes it more bearable. And it's totally safe for a VBAC mom to use. So I really highly recommend hiring one, or maybe your doula has one, or maybe the hospital even has one. Ask if you want, you can get one. It's not so expensive. You can get it online. I've seen it online. And get for the TENS machine, get the larger stickers, the bigger ones. They have small ones, and then they have the larger ones. The larger ones help spread. So basically, it's small little surges of current, which distribute the pain. So the larger ones helps more for a laboring mom, and it's totally safe. Don't be freaked out by the electricity part. It's safe. You can ask for gas to help with the pain. So you basically suck it in, and it really helps take the edge off the pain. And so for some moms, it makes them kind of woozy and takes their mind off the actual contractions. And it's a very not so medical way of managing pain. Better than the epidural for sure. So that's what you want to say. For example, and you can tell them what kind of pain meds you want after you've done your childbirth education classes, so you are well prepared yourself as well. Okay, so this is the main your I think this is the biggest part of your birth plan. Actual birth. Ask for a perineum massage. I don't know if your doctor would do one or not, but ask her. Maybe she does. Mine did. She sat down for an hour or two and she was massaging it to avoid tears and to support the perineum basically. So when the baby is coming out, let me use my baby. So where are we, baby? Here's our baby. Okay, so when the baby's coming out, this is the pelvis. My baby's inside. You can see. Okay, and when the baby's coming out, the perineum. So when the baby pushes it, when we support, I don't have a artificial perineum to show you. So when the perineum is supported, as the baby comes out, there's less chances of it tearing. Okay, no episiotomy. Mother directed pushing is very, very important, because what happens with when the doctor or the nurse tell you push, 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 push. You end up pushing, and this forces. Let's come back, baby. This actually forces the baby to come out faster when you push, 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 even if you don't want to push, and this can actually cause the tears more. And so we want to avoid that. We want whenever it'll feel like pooping. Okay, so you will feel the urge to push. So whenever you feel the urge to push, push. When you don't feel the urge to push, don't push. Just whenever you feel the urge to push, let the doctor know, obviously, that I feel the urge. Like, she'll know. Just make sure you're fully dilated, of course, and she'll guide you about that. So push I was fully dilated for 2 hours, but I didn't feel the urge to push, so I didn't push. So whenever you feel the urge to push, push according to that. So it's mother directed pushing, not doctor or nurses directed pushing. That's very important. So when you feel it, this will help the baby come gradually down. It might be fast, it might be slow, you don't know. This is how you will feel it, and you will do it. You will talk to your baby, you will talk to your body, and you will help the baby come down. Okay? Birthing in any position is very, very important. If you are on your back, let me take the baby out first so I can explain on the pelvis. Now, this is a pelvis model, if you see. If you're on your back, this little tailbone here is tucked in. Okay? Now, when you're squatting, so you've got gravity on your side, this little thing opens up. So imagine the space that has increased for you and for your baby. See? So this is you down, laying down on your back, and this is you squatting or on all fours or in a sitting position. Having birthing in any position is very important. If the doctors vary about you giving birth on the floor, for example, on all fours, so you can get onto the bed. You can make the bed in a sitting position. You can use the bed to support you. There are many ways that you learn in your childbirth education classes how to use the bed optimally to give birth on the bed, but not on your back. So I was sitting and I was squatting so I didn't get tired. So I had the back of the bed supporting me, and I was in a squatting position, and I gave birth in a squatting position. So it's very possible. Okay. Um, Postpartum pitocin for placenta, that's usually a protocol in most hospitals. Maybe you want it or you don't want it. It helps eject the placenta out faster, or you can just start breastfeeding the baby, and that can contract the uterus and eject the placenta out as well. So this is your choice, which you want to put in on your birth plan. Delayed cord clamping. Now, let me show you. This is a little baby with his cord attached. When the baby comes out, the cord will be pulsating. It would be red, maroon, because it's full of blood. It'll be thick, and it still has a lot of the placenta blood. It's attached to the placenta. What you want is to wait for it to stop pulsating. You want all the blood in the cord, because it has a lot of stem cells and a lot of iron reserves, to go into your baby. You don't want them to clip, clip, cut immediately, because then a lot of the blood is still in there. And this blood has a lot of nutrients, a lot of iron reserves for your baby. So make sure you put it in your birth plan. And we'll talk about the birth plan approval next, so that the pediatrician also knows that this is your preference that you want. What you can do is the baby comes out, you put the baby in your chest, you start breastfeeding the baby. Your placenta is delivered, the cord is long enough for the baby to come to your chest while the placenta delivers, and you can just wait. Or you can, if they're really in a hurry, you can tell them you want to milk the umbilical cord to make sure all the blood is moved into the baby, and then they can clip and cut. If they cut the cord immediately, it's very hard to cut as well. And when the cord blood has gone into the baby, it's all white and limp, and it's like cutting a butter. So it makes a big difference. Read up on the benefits of delayed cord clamping. It's very important. Okay, and at least 5 minutes, 3 to 5 minutes at least. and otherwise it can be up to 20 minutes to 30 minutes as well. Okay, so make sure you have that on your birth plan. Do you want your placenta to be saved? I like to bury mine, so I made sure when the placenta came out, I wrote in my birth plan that give it to me. They put it in a bag and gave it to me so I could take it with me. Do you want your partner to help birth the baby? Maybe the partner wants to cut the cord. Maybe you want to reach down and pull your baby out. Maybe you want to use a mirror to see the baby crowning, and see how hairy your baby is. So you want whatever you want for the actual birth. Please make sure you put it there in your birth plan. Okay. The baby. Now, you want immediate skin to skin bonding. That's what you want. Okay, so make sure you put on your birth plan. Immediate breastfeed. Do you want to breast crawl? So breast crawl is basically the baby put on your chest a bit down from you. So your breasts are up here. I have a breast model. Let's use a breast model. So this is our breast model. Okay, so the breast model's up here. The baby. Do you know that the areola is a darker color so that the baby can find it and come to it and latch on it? So subhanallah, the baby can actually crawl by pushing and smelling and detecting by the color, because the baby's sight is very less when the baby's born, and then it can find the breasts by the color of the areola and latch on. Maybe you want to experience that. It's very amazing. You can see some YouTube videos about the breast crawl. So the baby finds the thing and it latches onto the breast. It's very, very, very fascinating. So if you want that, you can add that to the birth plan so that they know this is what you're going to do. You can ask for the baby's Apgar to be on your chest. The baby's on your chest. They want to do the Apgar. Some doctors stress, oh, but we want the baby, we want the baby. We want to do the Apgar. My doctor was like, I'm witness of the Apgar. So Apgar is the activity of the baby, the grimace, the pulse rate, respiration, and like the appearance of the baby, how the baby looks. So it's like by numbers they record it. So it can easily be done on the mom's chest. The chances of a better Apgar rate is higher if the baby's on the mom's chest and it has warmth and love from the mother. Okay, here I've mentioned the delayed cord clamping again. The partner cuts the cord or not. No bath. I was very particular about that. I did not want my baby to be bathed. If you want your baby to be wiped down, you can say that. The baby's usually covered in a white waxy substance. It's called vernix. It's got a lot of antibody properties. So you might want it to be rubbed in. You can tell the nurses and the doctors that, or just make sure it's in your birth plan so that they know. And once they give it to you and you're doing skin to skin, you can just gently rub it in. So vernix rubbing is very important. It's very good to avoid any skin issues later on in life. Okay. Rooming in with the baby. Tell them that you want to room in with the baby. You don't want the baby to be taken in the nursery. This helps make sure that the baby is fed on demand. So whenever the baby cries, you just put the baby on your breast and the baby breastfeeds. Okay, no pacifiers, no formula. Just make sure what you do that. What I did was I made a cut card, a little card which said, I am a breastfed baby, no pacifiers, no formulas. And I stuck that on my baby's cut so that even if they had to take the baby to the nursery for any checks or anything, they know that this baby's not going to get a drop of formula or pacifier. Okay, if not the mom for any condition, we don't know how things go. If the baby mom cannot be with the baby or the baby cannot be with the mom all the time, you let them know that the dad would be with the baby so they know what they're doing, and if you want to vaccinate the baby, if you don't want to vaccinate the baby, the eye drops, everything, put it on your birth plan, what you wish for your little baby. Okay, now the backup plan, which I was talking about. Is induction safe for a VBAC mom? uh, it is not exact, I wouldn't say it's safe, but if it's needed, then mechanical induction is recommended. So basically, mechanical induction is it's like a little balloon they will insert in the cervix, and the balloon will start dilating, and once it hits around 6 centimeters, it will fall out. By then, your body would have kicked into labor if it's ready. Okay, just make sure, like you can specifically say no pitocin, because pitocin can cause very rigorous contractions on your uterus. So this is something you need to know on, you need to have on your backup plan. Okay, so this second safe method for a VBAC mom for induction is sometimes to insert like a suppository which has some medicines to help soften and dilate the cervix. So maybe that's something you could discuss with your doctor if induction is needed. Okay, for the C-section, consent is very important. Just make sure it's a very informed decision. We will come to informed decisions next. Tell them you want a gentle C-section. You don't want the baby to be yanked, pulled, you want, just read about gentle C-sections. You want the baby to come out on its own, just help gently. You want your partner with you or not, it's up to you. If sometimes they have transparent drapes so you could see your baby being birthed actually. If you want to breastfeed in the theater or not, if you want to lower the drapes if it's not the transparent kind to see your baby being born. All these things will make sure your C-section even is according to your wish if it's needed. Okay, so always have a backup plan. It's very, very important. It doesn't mean that things are definitely going to go that way. No, it's a backup plan. If things don't go this way, it can, at least I know that I've prepared for a backup plan. This actually prepares us mentally as well in our subconscious, and it helps us accept if things don't go how we had planned it to go. Okay. And last thing I've written here is arms free to hold the baby, to do skin to skin, and chest empty. Like I said, the monitors for the pulse and all that can be on the back or upper on the shoulders, so that our chest is free to breastfeed the baby and do skin to skin, even if we go for a C-section. Okay. Now this is the informed decision part. Using your brains. Now I love this tool. It helps a mom decide in a trying situation if she's making the right decision. So basically, if an unprepared circumstance comes in, or even while you're making your birth plan and you want to decide, um, if it's like a decision tool, helpful decision tool, what are the benefits? Okay, the B is for the benefits. R is the risks. What are the risks? Are there any risks involved in this, and what are the benefits? Are there any alternatives? If I feel the risks are more, is there an alternative which might have lower risks and more benefits? What is your intuition saying? What do you feel? Your gut feeling. Um, you could do istikhara. You could decide. How what you feel inside. Should I go for this one or should I not? Your gut feeling, your intuition is very, very important as well. Okay, after you've weighed the risks and benefits, do you need to decide now? Is it that crucial? If, for example, it's a C-section consent, yes, maybe you need to decide now. But if it's something else, does the decision have to be made now? Maybe after a week or 2 days, the circumstances are different. It's easier for you to make the decision. So now or later, the N is for that. And S, is this a satisfying or safe choice? So whenever making, this is like a decision tool, whenever making a decision or you don't know if I should go for this or not, use this brains tool to make sure you make the best possible decision for yourself, for your baby. Okay, so I love using the brain informed decision tool. It's very, very useful for birth and making your birth plan and planning your birth. And if things go other way, everything, use your brains. Now, plan approval, who and why. Now, having your birth plan ready earlier in your pregnancy is very important. Don't wait for the last trimester. No, in your second trimester, have your birth plan ready, because sometimes it needs a lot of reviewing. Sometimes, even my birth plan, I had to take it to my doctor. She said, but this is possible, this is not. So I had to modify it a lot. And then getting it approved from your doctor is the first thing. Have her sign it, have her stamp it, take multiple copies, make sure she signs and stamps all the copies. So the staff on the day, if your doctor is not there yet, they know the doctor has approved all this and they have to follow it. Okay, so having it approved is very, very important. Even if you have a backup doctor, always have a backup gynae, because maybe the doctor has an emergency, doctor has to travel or anything. Make sure that your backup doctor you have like a birth plan approved by her also. If you have a midwife, make sure she approves of it. staff nurses or the head of nurses of the labor ward. Take it to them before you go into labor and get it stamped, or not necessarily stamped, just make sure they know and they approve of it, or just show them that this is the approved birth plan by my doctor. um, Pediatric herd or peace department. Now that's the hardest one, I feel. At least that's what I faced. The on-call registrar pediatric doctors weren't very supportive or cooperative in comparison to my doctor. So making sure that you show it to them from beforehand. You tell them this is what I want for my birth, and trying your best. You don't know who's going to be on call that day, but if you can find out like proximate shifts and stuff, just make sure, try your best to show it to them as well, so they know that you do, especially for the baby's part, that you want delayed cord clamping, that you want ABGAR on the chest. These are the initial things that they might have issues with. So it's good to have it approved by the pediatric department as well, or the pediatric head or the on-call doctors. Okay, so birth plan approval is very important. Maybe you have a birth plan, you've worked on it, it's already is in your bag, but when you go on the day, it's useless because they say, oh, but it's not signed by the doctor. Oh, but then they might not, approve of it or consider it. So it's good to always have an approval by these people before. Okay. Now, what happens if you fail to plan, you plan to fail. So prepare for success and make a plan. That's why we have the backup plan. Okay, so you've planned all this. This is your perfect birth plan, your perfect birth which you want. Birth cannot, like, this is the next thing I think we'll come on to. Things might not go exactly according to this plan by the, exactly, but at least you planned. You're mentally prepared for everything. The staff, you've prepared them. Your doctor, everyone knows what you want. If things go a bit here and there, because birth is an unpredictable situation in our lives, at least you tried your best, you planned, and you prepared, and that's it. Everything else, leave it on Allah. Inshallah, Allah will, like, if Allah sees a person's intention and all the prayers and everything, then inshallah, everything would go smoothly. Maybe not dot to dot according to the plan, but at least you have, like, for example, it's like a pathway. Like, you need to go from here to here. You've planned for it. It could go like this, but you get there in the end. You get to your VBAC. It might not go a straight line. It could be a bit like a twisty line. But because you have a plan, you know what to do. If you don't have a plan, you might be lost. You might give in easily to a C-section. You might be bullied by doctors or nurses or anything. So it's very important to have a good birth plan for yourself, for your guidance, and to guide the staff dealing with you or the people who are going to attend to your birth. Okay? Support and guidance is very important. I am here to provide this support and guidance. This is my contact information on the screen. You can WhatsApp me on my number. You can email me. I can help you make a visual birth plan if we can discuss it. And some, like, a few moms, they're not so computer savvy, and they need help finding these pictures and putting them together. I'm here to help that. I provide the service for a nominal fee. So if you need this service, let me know. If you need any guidance through WhatsApp, virtually, I can be your virtual doula. I can help you as much as possible virtually, and this is my contact information. Okay, and I wish you all a very safe childbirth, and thank you for watching this presentation. Assalamu alaikum.